Just tuned in, we're discussing the report that says 250 people are dying every week in our hospitals in England due to long waits in A&E, according to emergency physicians. Well, joining me now to discuss this is Martin Gower, former NHS Trust Chair. Martin, what do you make of these statistics?
Well, can I just say the first thing is how distressing this is for people and families of those who have been impacted like this. It's absolutely ghastly, and I genuinely do really feel for them. You know, this isn't just about numbers and stats; it's about people. People have been struggling, and their supporters and relatives as well. Now, having said that, I mean, this sounds very third world to me. Um, I just can't see why this should be happening, other than the fact that the system just doesn't work. This is, of course, about NHS in England. There is some evidence that in some of the other parts of the UK, it could be even worse. Um, Now, excess deaths in the UK in England are much higher than the average for Europe anyway. And I think there are several things that drive this. First of all, the access to health services during the COVID period was pretty awful. We were told to save the NHS, and that really meant by not bothering them. At least that's how a lot of people interpreted it. So I think you're getting people with more serious conditions presenting at NHS, in fact, I know you are. Then we've had strikes, we've had junior doctors who are often very important in NHS and also very important in the role of discharging patients to make way for other patients that need to be admitted in an emergency. And then, of course, we have the issue of delayed discharges, where it's not been possible to get a proper package together for somebody who is being discharged from hospital. And the longer people stay in hospital, I think for a couple of weeks, an elderly person could lose maybe 20% of their muscle tone. So there's all these people who are coming into hospital independent, but when it comes to discharging them, they're dependent. And that is a really big challenge for social care. Um, I mean, my overall take on this is that there's a lot of people in the NHS, among the management particularly, and among the clinical staff too, who are just waiting for the next government and the fact that lots of money will be poured into the NHS, lots more money. And, the staffing, I found the management folk in the NHS were generally pretty much of the left. In fact, people who I thought were highly intelligent were thoroughly looking forward to having a government led by Jeremy Corbyn. I worked as an NHS chair until mid 2020. I think I could add to that the admission process for admitting people can be very slow. The discharge process can be very slow, not only because of social care, but sometimes people are in an extra night or two because they're waiting for prescriptions. So I suppose, in summary, will this ever improve whilst the NHS, unlike most health systems in the developed world, is in the hands of politicians? And I'm sorry to those who are politically motivated, I'm sorry, it's never, ever going to work very well.
Well, Martin, definitely food for thought for me as a politician there. I'm very grateful to you coming on air and sharing your insights. That was Martin Gower there, former NHS Trust Chair, on our story that more than 250 patients are dying unnecessarily each week because of long A&E waits.